This is, of course, with regards to tonsillitis. We'd like to welcome our guest in the studio today. Thank you so much, Dr. Ng, for joining us.
That's right. Let's welcome Dr. Untuk, ENT specialist, HKL. How are you this morning?
Thank you. I'm fine today.
Good. So let's start with tonsillitis. Basic information on tonsillitis for the viewers out there.
So basically, when the patient normally when the patient come to our clinic, they will ask, what is tonsils? First thing, what is tonsils? So how many tonsils in the oral cavity and the nose? Actually, tonsil is an aggregation of the lymphoid tissue in the airway passage and in the digestion passage. We call it aerodigestive passage. That means that in the mouth and also in the nose. At the back of the nose, there's one tonsil called adenoid tonsil. So surrounding the essential tube, there's called tubal tonsils. Then all the way down to the oral cavity, inside the oral cavity, normally what we see inside the mouth, you can see a two swollen kind of like a ball. Both sides, left and right. That's called palatine tonsils. And then the back of the tongue, there's also a lingual tonsils. So all these consist of a ring. I mean, like a filter, your mouth, and then also your nose. Whatever you eat or when you breathe in, the tonsil is like a filter of the microorganisms. It will try to filter out the microorganisms before you inhale or before you swallow the food and the air inside your body. The basic terminology, I try to use the basic terminology to explain what is tonsils. It's the aggregation of lymphoid tissue.
Well, how does it get infected to begin with?
Okay, let's say you breathe in the air. The air is like as usual, because microorganisms, you got dust, you got all this kind of pollution. So that when you breathe in through the nose itself is like a filter, and then all the way back inside your what I call it back at the back of the nose, there is also another adenoid tonsil. Inside the tonsil is a tonsil. If you follow the structure of tonsil, it's not a smooth surface. It has a crisp, in between. So these crisps is trying to trap all these microorganisms. Once it trap the microorganisms or this foreign what I call it the dust or particles, he will like there's a cell called the antigen presenting cells, APC. The cell will try to capture this kind of microorganism and bring it to the T hyper cells. T hyper cell is one kind of cell in our immune system. This T hyper cell will bring this to B cells, another cell. B cell will secrete the immunoglobulin, or call it antibody, which is this kind of what I call it the immunoglobulin that is secreted is actually in this tonsillitis. In this tonsil is immunoglobulin A. So we call it secretory immunoglobulin A, secretory IgA. It's form a local immune system to our body, or call it secondary immune system. So the antibody will come out in the surface and try to kill all these microorganisms before you swallow in or before you breathe in inside your body, the air and the food.
Now, just to take it a little back home, a lot of people, when we get tonsillitis through fever, flu, whatever, they end up taking warm water and salt, and they say gargle with warm water and salt, you're going to be okay. And this is what they recommend from age old. Even our mothers do that and say quickly gargle with warm water and salt. Is this something that's actually would this be considered as a cure?
I try to explain in what you're trying to tell me. Okay, when you swallow with the gargle water, it's a normal saline. It's a salt water. Salt water actually it will help to kill the bacteria, just like what the tonsil trying to do. But tonsil trying to do is it creates immunoglobulin to kill the bacteria. But now what you're doing is you try to use the normal saline to help you to kill the bacteria or the microorganisms. In terms of effectiveness, I don't think so. I don't think so. You still need some medicine
to
help you to kill.
With the infection.
Because the immunoglobulin A itself cannot help you much. What about about normal saline? I don't think it's helpful. Maybe it help you to shoulder a bit, lessen the pain, fasten the recovery.
That's pretty much it.
It will reduce the microorganism, but definitely it wouldn't kill or couldn't cure you.
There you go.
You need to take something.
We have Linda online. One of our first call this morning. Hello, Linda. Good morning.
Good morning.
Hi.
Hi. Merry Christmas to you.
Merry Christmas,
Linda.
Yes, you have a question, Linda.
Yes. I would like to make a research to my family. Okay, to my brother, Cynthia, Victor, Everything, and my mom. Merry Christmas to you all and Happy New Year.
Thank you.
And Happy New Year to all Malaysia also.
All right, Linda.
And God bless you all.
Same to you. Thank you so much for your wishes. Now, do you have any questions for the doctor? Linda? No. Okay, well, you called in with a wish. Thank you so much. We wish your family all the same as well. But meanwhile, Malaysia, if you do have any questions for the doctor, 22829062, 22823043. We'll be taking your calls in terms of tonsillitis, actually. What is a question that you have? But like the doctor mentioned, so your warm water and salt doesn't exactly play the most important.
It cannot cure you.
It can't cure you. My God, here we go. The doctors literally debunked the myth.
You see, inside the oral cavity, there's a lot of structures.
Okay.
A lot of people will mistaken like normal pharyngitis with the tonsillitis. Normal pharyngitis, you wouldn't get so much of fever, you won't get so much of pain. You just have a mild fever, a bit of throat irritation, a dryness. You know, the thing will get well. Even though you take a symptomatic treatment, like Panadol, paracetamol, all this, we try to relieve the symptom. But then after like about a week, the thing will go off, the infection will go off. Whereby the tonsillitis, you will get a very bad sore throat, you got high fever, you cannot swallow, very painful. That you definitely need to see a doctor to get some antibiotics.
Okay, now if it's that painful, do we go into surgery? And let's start with the pictures that we have on the screen right now. Could you just explain to us what these are as we go through the pictures, doctor?
Okay, you look at the center, you see there's a uvula.
Yeah.
Both sides is the tonsils. You see the two swollen thing there?
Yeah.
You see uvula also a bit swollen in this case. This patient is just having a tonsillitis. It's just starting. Just a starting of a tonsillitis. Maybe a few days, 1-2 days, you get this picture. Just
and
starting. Yeah, just starting. So you see the tonsil is quite big. This is chronic tonsillitis. You get a lot of whitish patch. It's called exudate on the tonsil crabs. All these show that this patient have a chronic tonsillitis.
Right.
Chronic means he have a multiple episode over the years.
Oh dear.
So infection happen again and again. That's why I call it chronic tonsillitis.
So this condition, do you have to do an operation or can you settle with antibiotics? I mean, this looks severe.
Yeah, if you we do things, we follow guidelines.
Right.
We follow the American Association of Otolaryngology. There's a suggestion when to do operations. What we normally practice is, what I normally practice is, I will see the patient. I will judge myself. I will assess the patient. Is it the symptom is regular enough, like 4 times per year?
Yeah.
Or more than 7 times per over the next last 2 years, or more than 3 times per year over the last 3 years. All together we just then whether the infection will cause you a lot of problems. You cannot go to work, your mother cannot go to work, your father cannot go to work, or yourself cannot go to work, or you absent from the school, you're very painful, or there's another risk like you have either you're immunocompromised. That all this will come to the our judgment whether we need to do surgery or not.
Hold the thoughts, doctor, because we do have another caller. Line started buzzing up. Hi, good morning, No.
Morning.
Hi.
Hi.
Morning.
Okay, I have a question for the doctor.
Yes, please.
Okay. My son has been suffering tonsillitis since last year. He was given augmentin for the antibiotic, and then the doctor changed to another antibiotic, Zitromax, anti-antibiotic. I don't know whether it's a good thing by changing the antibiotic, or maybe the earlier antibiotic is not working that well.
How old is your son, Noor?
He's 10.
10 years old.
Yes.
Okay, all right.
Okay, my question is, the PITS does not suggest surgery.
Right.
But the PITS say if I were to go to the ENT, quote unquote, definitely they would suggest surgery. Okay, but then he has been missing school days a lot. Okay, and I was also told by the PITS that trying to restrain him from taking chill or ice drinks. Okay, I do not know. Is it that bad if he were to take either drinks, chill or ice? Because I can actually control his intake at home.
Okay.
But not at school.
Right.
Because whenever he got his tonsil, if he starts off with a cough and runny nose, the tonsillitis will not be that bad. But if it starts off with a fever, then he needs an antibiotic. But with that tonsillitis, he doesn't have any difficulties swallowing. He doesn't complain sore throat. But if you were to look at his tonsil, it is very large and red.
Oh, okay.
Okay. That's about it.
All right. Thank you, No. Thank you very much. Happy holidays.
You're welcome.
Yeah. So, okay, I'm not here today to do a comment of what other doctors going to do on this kind of patient. But what I practice is follow what she described. First of all, the doctor start with augmentin.
Yes.
I think is a quite a bit like what you call it. We call it the how to say the augmentin. I'm not going to use the augmentin or whatever term.
Is it too heavy for a 10-year-old
yeah,
kid?
it's too heavy, a bit too heavy.
Okay, so that's what you wanted to say.
Usually
This is too heavy for a 10-year-old kid.
Nowadays in our practice is like we worry about the antibiotic resistance.
Right.
Antibiotic resistance, and then all the tonsillitis is caused by the bacteria. It can be caused by the viral, or allergy, all this. But then usually we will monitor the patient. Let's say we try symptomatic relief, give some like analgesic, gargle, and then we observe 1-2 days, see whether it respond or not. If not respond, probably a high fever, breast pain, cannot even swallow, then we start antibiotic. But what antibiotic we use? Usually we use the penicillin group, much common antibiotic first.
Okay.
Let's say we try penicillin, and say it doesn't work, then we go for something more higher level of antibiotics.
What about surgery for Noor's son?
Of course, again, I'm not going to comment what other doctors do, but what I did is, as I told you, if let's say I will see my judgment, I see the patient whether indicated for surgery, that's why I told you, the frequency of the infection, whether the severity of the infection, is it very bad, cannot go to school, all this, why not doing surgery? There's no...
Is there any side effects for a 10-year-old kid to remove his tonsils that early?
The most important about the surgery is one thing, you must get the patient informed what's going to happen.
Right.
Okay, we got to take out the tonsil, very simple. Our job very fast, very simple. 10 minutes, 15 minutes, we take out the tonsil. But then, what happened next? Okay, patient always tell you, what happened next? We affect the voice, we affect the immune system. But I tell you, definitely not enough evidence to show that it will affect the immune system, because the tonsil is actually help you in terms of local immunity. It's not like your body, the whole body will secrete antibody to this microorganism. It's just like locally, there's like just like a filter. It filter all the microorganisms.
So, Doctor, curious, I think a lot of questions out there coming in from our viewers as well. Do you then recommend for anyone who's got this major problem with tonsillitis to actually remove it? Would that be a recommendation?
If it affects productivity too much, not being able to work, not being able to go to school.
So would that be like a blanket, opinion that you'd give?
Of course, if you think the tonsil affect you too much of daily activity, why not take it out of the tonsil?
And it has no side effects whatsoever.
Everything we did, there's a risk.
Right.
Just like surgery we do, also there's a risk. You cannot say even you walk also you can fall down. You drive also get accident. Just like we walk, we try as a surgeon, as a doctor, we try our best.
You ride a horse, you fall down.
Bear in mind, the surgery you do, there's one thing you probably have a pain after surgery. Second thing, there's a bleeding. There's always this is a risk. You must come into account. You mean your consideration before you decided for surgery. Are you willing to take the risk?
Right.
Even though the risk is minimum, but are you willing to take the risk?
Okay. Now I think we have a little more slides on the screen that we have questions to ask you about. So maybe we can have a look at those slides. Here we go.
This is the normal anatomy of the nose. On the nasal and oral cavity, you can see the uvula at the center. You can see a two tonsil there, soft palate. At the back is the posterior pharyngeal wall. This is the airway, and also the oral cavity that you take the food, you pass through this filter system before you go into the esophagus. You see the tonsil actually helping you to filter out all the microorganism, all this. Whenever microorganisms is stuck there, you start to inflame. Antibody come in, tell you how to fight with the microorganism. This is compared to just now the previous side. Previous side you can see a very big tonsil. Different, it doesn't see any tonsil. It just see the very weak pharynx. Soft palate. This is a pharyngitis.
Okay.
I want to show you this slide. I want to compare the tonsillitis and pharyngitis. These two different things.
Right.
Pharyngitis most of the time is caused by virus.
Right.
So you don't have to take antibiotics, any surgery. You just take some analgesic and gargle. normally if you get well,
warm
if
water
you
and salt.
Yes,
that
it
helps here.
It helps.
Yes. There you go. That warm
Tonsillitis
water
is
and
a bit
salt.
difficult. One is swollen out, is a bit difficult.
Yeah.
Right, Doctor, what are the good practice, good things that we can do to protect our tonsils?
Okay, the good thing about tonsil is like you must take care of hygiene. Personal hygiene very important. You try to whatever you take or what. Make sure that it's clean, it's hygienic. It helps to reduce the microorganism in the going into the body.
Right.
Therefore, you reduce the frequency of the tonsillitis.
Okay. I think the other question that's pretty much burning on everyone's back of their mind is there a home remedy that you can... I know I'm asking you, oh, okay, there you go, he's not here. But is there a home remedy that we can practice when we're at home besides the warm water and the salt? Is there something that you would do for your children, for instance?
I wouldn't suggest all this home. I'm not the best person to tell you all this because I never studied for that.
Okay.
I'm not expert for that. But what I suggest to the people is that you must take care of the hygiene. You must cook your water, boil your water, cook your food properly. When you go to a very congested place, you better wear the mask or whatever. Don't try not to go to a very congested place. Take care of the hygiene, take care of air, take care of the food. They will definitely help you to reduce the chances to get the infections.
Children who go through this condition, it's going to be a challenge for the parents because they're going to get cranky because they're in pain and going to give them medicine, and some of them don't even like to take medicine.
Yeah, exactly.
So what's your tips for parents who have to undergo this kind of situation?
Okay, first of all, you must understand what is the problem. Is it a tonsillitis? Is it a pharyngitis? Is there any other problem? Is there ulcer in the mouth? You try to understand the cause.
Yeah.
Why the child react like that? When you know the cause, you try not to panic.
Yeah.
Don't panic, and then try to get the doctor's opinions.
Right.
Get some medicine. Medicine is not instantly cure you.
Yeah.
It will take some time. Let the medicine work for a while. Don't panic. Just be confident to your doctors and be confident to yourself. Normally, the child will recover very fast. You will surprise today, very ill, tomorrow you will jump here, jump there. Children recover very fast. As long as the body is healthy, take care of your diet, take care of hygiene. Normally, you recover very fast.
Hygiene. One last question before we let you go. Antibiotics. I think every time we go with anything and everything to a doctor, no pun intended by the way, but a lot of them recommend antibiotics. And as we heard, Noah was saying her doctor gave her son Augmentin, and you were saying that Augmentin is a bit too heavy for a 10-year-old child. Thus, would you recommend antibiotics as something on a regular basis for people with bad tonsillitis? Or do you think that they should try something a little not so severe in terms of antibiotics?
I will say I will see the situations. I will see the situation. If I don't think the child is risky or any other problem, medical problem, why not starting something simple like penicillin? The doctor give opinion. The doctors have their own points also, because this Augmentin is covered for certain group. It also cover for certain group microorganism. It will actually I think they use it because it's like if you know the complication of tonsillitis, you will like certain type of microorganism. You secrete certain enzyme to destroy the drugs like penicillin group. The Augmentin actually have one added drug inside, a medicine inside. He will to overcome this problem. This bacteria is very strong. If you secrete an enzyme to destroy the basic antibiotic, this bacteria is we call it strong. Or other type of bacteria. So the bacteria also will cause you heart problem and some other problem.
Okay.
So we see the risk.
So it all depends on how severe the case is.
There's no fixed rule to say that you must start this, start that. But from my point of view, is like we try to reduce the antibiotic resistance
as much as possible.
We don't use something very like very high so-called high profile kind of drugs to kill this. We start the simple one. You start for 1 week. We see how is it.
Okay. All right. There you go.
Thank you so much for joining us. Your Christmas wishes to your friends and family members, Doctor.
Merry Christmas to all the people, and I wish that all the people will be our people will be peaceful and healthy and be happy always.
Yes. Don't eat too much and don't drink too much ice.
Thank you so much, Doctor.
Thank you.